This is In the Loop. I'm Christian Bryant. Stop me if you've heard this one before. A new disease outbreak has been detected on another continent. It's spread to the US, where growth has been exponential, especially in New York City. While it's been 2 months since the disease was first spotted, the US is struggling to muster the tools it needs to contain the outbreak. It sounds like where we were with COVID in March of 2020, but now we're seeing something similar with monkeypox. The latest outbreak of the disease has spread to most US states and dozens of countries worldwide. The US has at least 2,000 confirmed monkeypox cases nationwide, with the official case rate rising more than tenfold in the past month. And with a testing shortage, it's likely that the actual case count is higher. We'll dig into the monkeypox outbreak in a moment, but first, let's start with how these diseases are different. COVID currently spreads more easily than monkeypox, as it primarily infects people through airborne transmission. Monkeypox spreads through close physical contact and exchanging of fluids, transmitting and often presenting in ways that can resemble sexually transmitted illnesses. And monkeypox can only spread once a person has symptoms, unlike COVID's asymptomatic or pre-symptomatic transmission. Also, unlike with COVID, we have an approved vaccine ready that prevents monkeypox transmission. An existing smallpox vaccine was found to work against monkeypox as well. There's also help on the way. The CDC announced last week that it has the capacity for 70,000 monkeypox tests per week, and that at least 300,000 shots have been made available to states, with nearly 800,000 more expected to be ready for distribution by the end of this month, according to the Department of Health and Human Services. But the jump from having the tools needed to stop an outbreak to actually using them has proven difficult. Vaccine rollout has been a bit of a mixed bag. Federal health officials have been working on getting vaccines out to cities and states, but with demand outstripping supply in epicenters like New York City, it's not a guarantee that everyone who wants or needs a monkeypox vaccine can get one.
We'll certainly need much more vaccine, and quickly, to meet the burden of disease here in New York City, the epicenter of the monkeypox epidemic in the United States. We share our New Yorkers' frustrations about waiting to make appointments or long lines. Please hear us when we say every action we've taken to date has been with one goal in mind: to get vaccine to the city and to get shots in arms as quickly as possible.
It's a misstep that has come as the US has had more than 2 years of experience combating an existing outbreak, and after a year and a half of experience distributing vaccines to slow an outbreak. And Dr. Anthony Fauci, director of the National Institute of Allergy and Infectious Diseases and President Biden's top medical advisor, has acknowledged the response hasn't been perfect.
It would have been good to have had a lot more vaccines available early on, but right now we have accelerated that extensively. Could we have done better? Always. You never say we did perfectly.
So why did the US miss this despite the recent experience of an outbreak? And what's needed going forward to keep this outbreak from spreading? To give us a bit more context on the issues hampering the response, we're bringing in Newsy national correspondent Axel Tercios. He's on the ground in New York City for us. Axel, how accessible are vaccines and treatments for monkeypox there now, and how are health officials responding?
Here in New York City, health officials are saying that they will now be focusing on getting the vaccine to those people who have not received the first shot. And of course, this is creating anxiety among the people who got the first dose of the monkeypox vaccine, because they believe that they are being placed at a risk of not getting the second dose at all. And the authorities in New York City are doing this despite of the advice coming from the FDA and the CDC, saying that the vaccine should be administered in 2 doses, and in order to be fully effective, 28 days after the first dose. We were able to speak to a media executive here in New York City, and he told us that he got the first shot of the vaccine. He was able to get an appointment from the state website, but he said that the whole experience was a complete nightmare.
There were constant glitches. And then when the vaccines became available, you had to go on as if you were looking for concert tickets. When I went to go get the shot, They said to me, well, we're not scheduling shots for the second dose because we don't know if we're going to get them.
The state of New York leads the nation in most cases, with the majority of them here in New York City. The governor of New York, Kathy Hochul, said that the state is expecting at least 33,000 new doses of the vaccine, and city officials here in the Big Apple are saying that they will now be getting at least 25,000 vaccines to be administered in the city. Back to you.